If you've had a baby born prematurely, your next pregnancy is considered high risk. One of the biggest questions I hear in my clinic is it going to happen again? The answer depends on why your first baby came early. The good news is that there are things that we can do before and during pregnancy that may reduce your risk and help give you the healthiest pregnancy possible. Today, I'll explain why preterm birth happens, what your risk is for another preterm birth, and how to prepare for your healthiest next pregnancy. I'm Dr. Jessica Poulin, a maternal-fetal medicine physician and mother of 4. I care for women with high-risk pregnancies every day, and one of the most rewarding parts of my job is helping women prepare for pregnancy after a difficult experience. If you've had a preterm birth and are thinking about another baby, this video is for you. So what is preterm birth? Preterm birth simply means delivering prior to 37 weeks of pregnancy. Some babies are born at 35 or 36 weeks and do very well. Others arrive much earlier and may spend weeks or even months in the NICU. In general, the earlier a baby is born, the greater the risk for complications. So why did it happen? This is the most important question. Not all preterm births happen for the same reason. Sometimes labor starts on its own. Sometimes your water breaks early. Sometimes there's an underlying issue like an infection or a uterus that's shaped differently than usual. Other times, your doctor recommends delivering early because continuing the pregnancy can be more dangerous than actually having the baby. For example, these cases include severe preeclampsia, poor fetal growth, placenta problems, serious maternal illness. So understanding why your first pregnancy ended early can help us understand and build the next plan for your next pregnancy. I always tell my patients, don't just remember that your baby came early, remember why the baby came early. That answer guides almost every decision we make in your next pregnancy. Will it happen again? So having one preterm birth does increase the risk of it happening again, but it's not guaranteed. One of the strongest risk factors for preterm birth is a history of a spontaneous preterm birth, which means that the labor started on its own or your water broke early without a medical reason to deliver. Your individual risk depends also on how early you delivered, why you delivered, your overall health, whether you have conditions like high blood pressure or diabetes, whether you have uterine abnormalities or cervical issues. Every pregnancy is different. That's why every pregnancy deserves an individualized plan. And this is where I think that women actually have the most control. If possible, you should schedule a preconception consultation with a maternal-fetal medicine specialist before you get pregnant again. During that visit, we can review your previous pregnancy, identify risk factors, optimize any medical conditions, and create a personalized care plan prior to conception. Some women may benefit from reviewing prior pregnancy and delivery records, optimizing blood pressure control, screening for diabetes, reaching a healthy weight if appropriate, eating a nutrient-dense, protein-rich diet, starting a prenatal vitamin before conception, reviewing medications to make sure that they're safe for the baby, and planning early prenatal care. Depending on why your first baby came early, your next pregnancy may also include some additional monitoring, including cervical length ultrasounds done vaginally, low-dose aspirin, more frequent ultrasounds to monitor the baby's growth, and additional monitoring throughout the pregnancy. The goal isn't to make pregnancy feel scary. The goal is to identify problems early when we often have more options to help you and baby and can intervene before you have a preterm birth. So there is hope. I've cared for many, many women who have had a very premature baby and later on went to have much healthier pregnancies. Every situation is different, but planning ahead gives us the best opportunity to reduce the risk, monitor closely, and also improve your outcomes. If you've had a preterm birth, don't wait until you're already pregnant to start planning. Your healthiest pregnancy often begins before conception. If you're not sure how to apply this to your own situation, I have 2 resources that may help. One is a free postpartum depletion quiz. You'll find it linked below, and it can help you understand how well you've recovered from your previous birth. And for women who want deeper, more personalized guidance before another pregnancy, I also offer one-on-one coaching through our Vital Femme MD program. If you find this video helpful, please subscribe because every week I share evidence-based information to help you navigate high-risk pregnancies and prepare for future pregnancies. Until next time, Mama, take care of yourself. I'll see you in the comments.